A while ago, we had a lady coming in who was diagnosed with MAC infection. MAC stands for Mycobacterium Avium complex, which is a bacteria that causes lung problems.
So MAC is kind of like tuberculosis, but it isn't. It is called NTM, which is non-tuberculous mycobacterium. It is a mycobacterium that is not tuberculosis. Point is, it affects the lungs just like tuberculosis does. It causes scarring and nodules in your airways. Worst yet, it is chronic. Why? Because the infection is difficult to eradicate. The tricky thing about treating MAC is that antibiotics and chemotherapeutics may not clear up the infection. And this is why we are asking the question, can TCM help Mycobacterium Avium complex?
When treating MAC, there are two things that we're trying to balance out. The first is to increase beneficial inflammation so as to increase bacterial clearance. But the bad side to this is that it can also lead to sustained lung damage. The second approach is to reduce inflammation so as to prevent lung damage, but this also means that there will be less clearance of bacteria from the body. When we talk about increasing the inflammatory response, we mean to increase the Th1 cell-mediated immune response, which will then lead to the release of pro-inflammatory cytokines such as IFN-gamma, IL-2, and TNF-alpha, which will then increase the host resistance against the infection. On the other hand, the Th2 humoral immune response will increase immunosuppressive cytokines such as IL-4, IL-5, IL-10, IL-13, and TGF-beta. In her case, the MAC infection is still in the early stages, and since there is no significant lung damage observed yet, the approach should be to upregulate her body's resistance towards the MAC bacteria to increase bacterial clearance while keeping an eye out on any lung complications. In other words, we want to increase the Th1 cell-mediated response while reducing the Th2-mediated response. Optimally, we would want a mild, steady, and long-term upregulation of Th1 cell-mediated immunity using Chinese herbal medicines without inducing excessive levels of immune responses. Our choice of formula is 人参养荣汤, a formula that supplements qi and blood. Upon research, clinical studies have shown that 人参养荣汤combined with anti-MAC chemotherapy was effective in accelerating the MAC bacterial clearance and improving the radiological features of the lungs. We also added on two herbs, 山药 and 薏仁, which along with other constituents of 人参养荣汤 like 茯苓, 黄芪, 人参, 当归 can increase Th1 response while also reducing Th2 immunosuppression. The research has helped me realize that TCM herbs can also be understood in a Western pharmacological way and complement today's Western treatment in the treatment of rare diseases such as MAC infection. Stay tuned for more fun content like this.